Welcome back to the Smile Reconstruction Podcast. I'm your host, Dr. Townsend, and I'm here with my co-host, Dr. Muir.
Hi there.
And we have two wonderful guests with us, Dr. James Rutkowski, the program director for the JU Implantology Program, and Dr. Michael Rosen, who is a final third-year resident in the JU program. Thanks for coming on, guys.
Thanks for having us.
Thank you for having me.
Today, we're going to talk a little bit more about the Jacksonville program and what it has to offer from the site director perspective, but also what's to glean from the resident perspective as well. And so we've got a few different individuals here that have vast experience on both fronts. Dr. Rutkowski, this is more for you. What do you feel like the role of a site director is, and why is it so important for you?
The site director is the most important person in the development of the resident, because they're with them on a daily basis. They're with them as they are onboarding a patient with their diagnosis, with materials that they're gathering for that diagnosis, construction of that treatment plan, the presenting of that treatment plan to the patient, the informed consent with that patient, and getting it all ready to actually perform the case and going through all the steps so that once they get into the case, that there's no regrets. What we want is we want clinicians who take on these very difficult, very advanced cases, many times with patients in their 6th, 7th, 8th, or 9th decades of life, who come in with a whole list of pathologies, a whole list of medications that they're taking. And all of those things can interact and affect the treatment for that patient, because sometimes these treatments, they might be removing multiple teeth of a terminal dentition, doing an alveolectomy, having to plan just exactly how much bone should be removed so that the end prosthesis, there's enough room for it, and aesthetically that it's going to be pleasing, that the flange of the denture, that the edge of it, the lip of it isn't showing on a big smile. Doing it right so that when they get to the other side, there's no regrets in saying, I wish I would have, had I known. And there isn't a case that any of us have done that afterwards we say, well, maybe I could have done this a little bit differently. But we don't want it to be a major issue. And that's where that director helps that resident in so many ways. And it's holding their hand, more so at the beginning, but then later on as they progress through it, letting go of that hand and letting them be who they are.
It's great to have that experience in terms of the more hand holding in the beginning and then taking the training wheels off, in a sense, to really get the ball rolling and letting that doctor really kind of grow into their own as they've kind of learned things from their director. So one of the questions that we kind of have for you, Michael, is when do you feel like you've had a challenging scenario that you were able to basically overcome because you had that guidance from your director?
I think that happens every day. Even especially when we started off. So I came into Brighter Way Dental in Phoenix, came with some background experience with surgery, restorative, placed some implants before. But definitely Dr. Erickson, at first we started doing cases together, working up cases. I get stuck on some extractions, and every time he'd come in and give me some good pointers, help me get the tooth out, take over, let me watch what he's doing. Each time I gained and gleaned some good experience that he's gained over the years, I'm sure from his mentors and from which they got from their mentors. It's so valuable to have that just a breadth of knowledge and experience that the mentor provides that you don't necessarily get just going to work in a private practice or just taking C courses and going back to start doing cases on your own. But when we're able to take the knowledge that we get from lectures or from discussions we have with other doctors and put it into practice with the mentorship that the clinical director provides, in my case, Dr. Erickson, really helps guide you towards success in what you're doing.
Yeah, I think that guiding towards success is critical, because just like Dr. Rutkowski had mentioned, avoiding those pitfalls before they even happen is such a valuable thing to have.
And I mean, that's where experience comes in is, hey, I made the mistake. Let me help you avoid it.
So, Dr. Muir, how have you noticed that, like the JU program, it's a little bit different than like a traditional academic residency program. It's not a whole lot of, I mean, there is book work involved, there are classes involved, but it's very clinical with your site director, working things through, working problems. How have you seen that be a benefit to myself? Because I'm your resident. How is
Yeah,
that? How have you seen that from your perspective?
I think that's a great question. It's different in that, um, a lot of times in a typical student teacher relationship, the teacher will come to the rescue when there's a problem. But as we collaborate together and plan together, it's not a rescue at all. It's tapping your teammate for the next step. And I think that really illustrates the whole idea behind this daily working side by side is we go over cases together, we plan together, and then as those cases are being performed, or the procedures are being performed, it's really, hey, we already talked about this. This is the part where it might get a little bit hairy, and so just holler when you get to that point. And a lot of times, I may just come in and see if you're at that point, and you may say, you know what, I've got this. And that's, I mean, how wonderful is it to continue until you need that help, and you get to the point where you don't. I mean, it's a great teaching model.
I think it's really
And
an awesome teaching model. What were you guys going to say?
as you keep doing repetitive procedures, and each case is unique, at the same time you get more comfortable with your skills. And the sign of a good director, which I've had, is each time you're a little more hands on yourself, a little more hands off on the director's end, until you're autonomous. But even once you're smooth sailing, you have that guy to rely on, which is a really good security blanket, even once you're 2 3 years in the residency. And you have that connection, like you guys said, even after you graduate, you have that person to call and run cases by.
That's very well said. And it's interesting because you start this relationship together, and you have a new resident, and they'll think, oh man, this guy's Superman, he can do anything. And over time, you're not needed as much as a supervisor or a site director, and that transition takes place where the resident is doing more and more and more. And it's a little bit sad because you don't feel quite as cool, but at the same time, it's wonderful to see just how far someone can grow in their skill set. And anyway, so it's been a lot of fun to do that. But like you said, Dr. Rosen, it's really also about building relationships. And unless you just simply don't mesh well, you spend 2 or 3 years with someone working side by side with common goals, and you can't help but build a relationship that absolutely should last throughout your entire career. And I think that is just a really neat program um, to offer that. You go to these other courses, and even if it's a maxi course, for example, which will be parts of about a week a month for 10 months, that's a lot of time together. But there's so many residents that go through those courses, it's hard to get the one-on-one relationship. And with this Jacksonville program, we're working one-on-one. And so that relationship flourishes, and really in the future, we'll have time to continue conversing and planning and talking about these cases and both of our continued educations.
Dr. Rosen, do you have like a specific example of when you had a case that was a little bit more challenging, or you kind of got stuck on a certain aspect of a case that you felt like your site director came in and was able to kind of help the outcome be better even from the get-go?
There are many cases of impacted third molars when I was starting off. That's more simple level. We have another case for sure where medical history comes into play, and there are patients that come in with complex medical histories, and right off the bat, especially earlier in my residency, I'm lost. So it's a patient that I think you talked to Dr. Rutkowski about, where the patient came in with, I think, 450 pounds guy, recently out of prison, drank like 14 or like 9, what are the big soda sizes per day, 2-3 packs of cigarettes per day. And he comes in and says, I want implants. And I'm kind of learning, how do I navigate this? Because the guy's clearly not healthy. His A1C is close to up 12 to 14, something like that. It really took the relationship with my director, may sit down and be like, hey, this guy wants implants. He's a young guy. How do I not just tell this guy no, but use the implants as a motivating factor to get this guy healthier and eventually get him into implants? Because he really didn't want a denture. He's a young guy, needed a full upper, single implants on the lower. And that's why I was able to game plan with my instructor. Okay, this is how we're going to approach this patient, far beyond the actual skills of placing the implants and doing the surgery, because that we can all learn. It's the patient interaction and the patient approach. So it's very easy to tell this patient, no, go find somewhere else. But rather, how are we going to get this patient on our team and get him to see where we can take him if he cooperates? And really, with Dr. Erickson's help, we were able to get that patient A1C down to 7 or 8. He lost 150 pounds, stopped drinking soda, stopped smoking, and now he has a full upper FP1. It's beautiful. And he's also patient for life. He says I saved his life. It's really, he's much healthier than he was. But it's the patient communication skills is just, when you learn from someone that has all the experience that you don't have, they can really, that's the biggest thing you can really take.
Yeah, and I 100% agree with you. I think there's a lot of CE courses out there that'll teach you how to place an implant, how to do all the surgical side of it. But I think one of the underrated parts about the JU program is the fact that it is a wonderful program in terms of teaching all aspects, the prosthetics, the patient interaction, the health history. I think just like your example showed that oftentimes the success of a case is not necessarily on, because you get to a certain point where your placement of the implant is excellent or very good. In most cases, it's more of the managing the health and the complications that becomes the biggest part and the wild card. And I think that is the part that the JU residency kind of takes to the next level, which is wonderful in teaching you that.
There's 2 places you find yourself. One is excelling in the patient communication management and getting medical history under control. And you said, yeah, the implant placement ends up perfect. You look at your x-rays, everything perfect. But you really, after 2 to 3 years in the JU program, get to the point where when you look at your implant, where 99 out of 100 people say, hey, that's perfect, and you start to criticize yourself and think what other people think is perfect is just, hey, that's ugly, I could do so much better. Get down to the microns of tissue positioning and bone height, and just really trying to go from good to perfect. That's really where you get after 2 to 3 years in the JU program. And that's been the biggest blessing I see, and the biggest curse, because I drive myself crazy now. But I know that if I did this program, all the work that I'm criticizing myself on now is just, hey, that's perfect. Just restore it. Good.
Dr. Rosen, I appreciate that you said that, because when you look at programs, well, when you look at this program, any doctor that's willing to dedicate 2 years, additional years to education,
Well, 3 on my end.
or 3, yeah, sorry, 2 or 3 years to education, it speaks volumes about that doctor, because it says, hey, I know I can learn some things in an easier way, in a more condensed and consolidated way, but I'm humble enough to know that there are ways where I can learn more. There are better ways I can serve my patients. And so what you describe as being able to criticize your own work, that's actually a really good sign. And I would hope that all of the doctors in the program would get to that point. because it's, it's not a perfect science. Every patient's different, every site's different,
Yes,
the
every
bone's
implant
different.
is different.
And so you strive for an ideal, and there's no definition of what that is in every case. So way to go for
And
self-emphasizing like that.
the challenge is learning to take each patient towards that ideal. Each one has its own roadmap. Right?
Yeah.
I also plug in when you're talking about mentorship in the program. I think what's really looked over is because we have our clinical directors who are with every day, but the beauty of the JU program is that the didactic is being taught by clinicians who are all top in their field. Rather, a lot of times in a university setting, the person who's teaching you has been in academics their whole life, and they haven't had as much clinical experience before the academic, right? So the fact that the instructors that we have in the didactic portions are all experts in the field, have their own clinical experience, and are able to show their own cases, and they all act like additional clinical directors in terms of if you have a case, they're all open for you to call them, to sit with you, to review your case, to get the results, and have all those additional experts to run your cases by. It's just a big blessing.
Yeah, and I think that goes back to expanding your pool, like you said, Dr. Rosen, of your mentors and the people that you can reach out to if when you graduate that are in your pool. And now you have like all these, like, I'm so privileged to even know the other residents, like Dr. Rosen, like I don't know you very well, but it's
Not yet.
nice that I feel comfortable that I can reach out to you. I can reach out to
Anytime.
Dr. Rutkowski when I'm done. And Dr. Rutkowski is a legend, and so it's such a wonderful blessing to have those connections to be able to
I'll
tap
tell
into.
you. I'll tell you. I went over. My dad's a dentist, big in implants, and I went through some of the old stuff I acquired, and there was a program from an AID meeting like 25 years ago. And I'm going through the list of speakers, and I'm saying, "Hey, that's one of my instructors. That's one of my instructors. That's one of my instructors." It was crazy. I really realized, hey, this is the kind of people I'm learning from. It's just the top of the field.
Yeah, it's really something to kind of fall back on and be like, man, I know some real leaders in the field of implant dentistry, which is really cool to kind of say that you were taught by these individuals. So, Dr. Rutkowski, for you, when you have a site director as the program director, how would you hope that every site director like trains their resident, or what are your goals for each site director in terms of getting their resident to that next level, like Dr. Rosen's gotten to?
I want every site director to look on their resident as a younger person, because some of our residents are in their 30s and 40s, but a younger person traditionally that is just so eager to learn, and to give them the guidance, the one-on-one, and the encouragement, but a accurate critique of what they are doing, and not just say, yeah, that's good, when maybe it's not, but having the ability and the strength, the wherewithal to be critical, but yet to still remain encouraging to the resident. And to realize that the resident at the beginning is going to need more support than they will later on. And I have a resident that just came out of dental school and came directly into the program. So doesn't have a lot of clinical experience at this time, yet they are working with a resident director that realizes that and says, we've got to help this doctor learn all of dentistry, not just how to put a screw in the bone and put a crown on top of that, but this entire patient evaluation. And I've worked closely both with this director, whom I just had a lengthy phone conversation with 2 nights ago, and as well as with this resident. And I've seen this young man who was so excited about coming in, so eager, and he was, and then he went through a stage of just being completely overwhelmed. And well, I don't know whether I can do this, Dr. Rutkowski. And I said, well, your resident director and myself and you, well, let's just talk and let's see where we need to go. And now this young man, who is truly a young man, I'm sure he's maybe 26, 27, 28 years old, just out of dental school, but I have seen him take off in the last month. And I just see him growing right before me. And I'm thinking, wow, what a legacy for this director to leave behind, because he's a little bit older. And, who knows, maybe this individual might end up becoming a partner in his practice, or might end up becoming a buyer in his practice. So that the patience that director had and has shown, the consideration of professional courtesies that he's shown to this young resident, that's what it's all about. And it's the real world that they're showing them. It's not in a hospital setting or in a university setting where, oh, don't worry, well, that didn't work out, we're going to have somebody from PROS or from perio or from oral surgery come in and help with this, and et cetera, et cetera. And all our residents are taught how to make referrals and to interact with all those people professionally. In fact, that's one of their 89 EPAs and trusted professional activities is, can they interact properly with other medical and dental professionals? So they're getting the real world experience, what it's going to take to become successful in clinical practice. And they don't necessarily get that in a hospital setting or a university setting. And this program enables everybody to grow, not just that resident, but that resident director grows. And I have a resident director who has got a young doctor who has been with them for about 6 months now. And he called me and reached out to me. He said, Jim, this is going so well. What do I got to do to get a second one? And I thought, ring the bell. That's what it's all about. He said, this resident is helping me so much in my practice. And the resident, as in turn, spoke to me and said, I can't believe how much I'm learning. So what a better environment. And that's what implant dentistry needs, because it is so complex. It is oral surgery. It is perio. It is PROS. And it is general dentistry. It is all of the above, and not just in one little box by itself. And so the resident director, I've got a great group of them. We've got 21 of them at the moment. And I'll tell you what, I'm proud to be associated with all 21 of them, as I'm proud to be associated with all 27 residents. I'm sitting here and I'm listening to Dr. Rosen, and I am just beaming inside. I think the smile's coming across on my face, but it just makes me so happy to see there's Dr. Rosen and Dr. Townsend, who are just growing and becoming. And thank you, Dr. Muir, for being one of our directors. You're part of this whole formula.
You're welcome. It's a pleasure.
Well, that was excellently said. I think just kind of to close, so we can hear a site director's side of what's been rewarding for you, but also Dr. Rosen's side, how it's been rewarding for you being a part of this program. Dr. Muir, to start off, how has this experience been rewarding from your experience? We heard Dr. Rutkowski share a couple other site directors' experience, but how has it been rewarding for you?
Anytime you can help someone, I mean, we do this hopefully on a daily basis with our patients, but if we can help one of our peers, someone that's coming to us for some guidance, it feels good. But that's not the only thing that being a site director does. It also helps me reevaluate why I do every little thing that I do and put a reason on that. Because when I get asked a question, why do you do it this way? I have to be able to say, why do I do it that way? And it's also been very refreshing when Dr. Townsend will come with something. He'll say, hey, this is what we learned. I'll say, my goodness, let's try it that way. That makes a lot of sense. And so it absolutely keeps me up to date with what's new and out there. It's been rewarding on all those different levels, but then also it allows me to be two places at once a lot of times, because we'll both be seeing patients in the practice and helping more people. We've been able to introduce more technology because it's difficult to know how to do everything all the time. But as we can divide and conquer our responsibilities in the office, that's been just a wonderful blessing. And so it's been a wonderful experience. And I just, I'm an advocate for the program, but I'm really an advocate for education and truly trying to be the best that you can be. And we help our patients do that. We improve their smiles. We help them be the best that they can. But how wonderful that we can, in each of our roles, come together and help each other be the best that we can be in what we're doing as well.
Couldn't be better said. Dr. Rosen?
So for me, something I realized is that the whole program, I was in from the first year, and all the ups and downs of a whole new program, and kind of just fell out. The whole opportunity to be a resident just fell into my lap, and it was really meant to be, because I feel that I wanted to make a career in implant dentistry, and where I am now would have taken me 20 years to get to the same point if I just stayed in private practice, did one case here and there. It's really propelled my career, and I really have the program, Dr. Rutkowski and Dr. Erickson and all the other directors, the entire program, to thank for that. And I know it's just the beginning. There's always more to learn. Even when I finish, there's always more to learn. Like I said, you can always get better and better. As long as we're striving to be better, we end up doing good for our patients and for ourselves. And to touch on what you said, when you're teaching is really when you're learning the most, because I'm blessed in our site to have 3 residents under me and to have a senior position there. And really, like you said, I tell them to do something one way, but then I have to tell them why I'm telling them. And a lot of times when I'm just figuring out my own way, I'm not questioning it, or I'm not giving a reason to why I'm doing things. Like you said, you always have to give a reason, and really makes you a better clinician through the teaching.
The teaching really elevates you to another level to become the very best you can be. And I think that's the whole goal that Dr. Rutkowski's got here, is to help us be able to turn around and hopefully teach it to the next set of doctors one day as well. So, well, I think that's kind of our episode that we wanted to touch on today, of the importance of the site director in the JU program and the benefits both to the site director, but also to the resident and the program as a whole. And so if you have more that you want to learn about either how to become a site director in the JU program or become a resident and learn more, please feel free to reach out to us or reach out to Dr. Rutkowski. And we would love to kind of help you along that path if that's something you're interested in.
I want to say thank you to Dr. Muir and Dr. Townsend for what they're doing with this podcast and helping to promote the program. I know there's people out there watching and listening because we get questions, we get new applicants, and it is through programs like this and your desire to spread the word and to help others. And that's when I was listening to Dr. Muir and Dr. Townsend talk, in that, everything that they're doing is in helping people and helping others. And boy, what a lofty goal to have in life. And Dr. Rosen, I want to thank you for being who you are and all the things that you do.
Well, thank you guys once again for coming on the show. And that is it for today's episode of the Smile Reconstruction Podcast. We'll catch you next time.
See you next time.
Thank you.